Hi, Jonathan.
Hi, Emily. How was your Christmas?
It was good, thank you. Good to have a nice break. It was small, obviously, family orientated, but yeah, still really lovely. Thank you. How about yourself?
Pretty much the same. Yeah, we had just the four of us, and yeah, didn't see anybody else. Went out for lots of walks and bike rides, and watched an awful lot of rubbish television, I have to tell you.
Yeah, Christmas telly, Christmas food. That's what it was all about this year.
Definitely.
So I was just going to kind of introduce ourselves for people who may not have seen these video blogs previously. So I'm Emily van der Venter, Associate Director of Public Health with Warwickshire County Council, and have been working really closely with Jonathan over the last 9 months now. And Jonathan manages the COVID-19 prevention and response team.
I do. And that was an add-on. My main role is I'm Group Manager for Trading Standards and Community Safety. I've been working with all the districts and boroughs since the end of March, organising and collaborating in terms of our joint response to COVID, particularly in terms of the regulations and businesses, supporting businesses and helping communities. So we've really valued across Warwickshire the role of community and voluntary organisations and just how cornerstone they've been in terms of our response. So a big thank you for all your efforts in 2020, and 2021 will pose new challenges for us, I'm sure.
Absolutely. So we've been doing these little updates as a way of just keeping some dialogue going with the VCS, keeping you up to date with our local rates and some of the issues, positive and negative, really, that have emerged in recent weeks. So as you say, Jonathan, big thank you to all the VCS organisations and our COVID-19 community champions, which we've got quite a good cohort of now working out in communities. So should we start by just sharing my screen, and we'll just give a bit of an overview of the recent data for Warwickshire. And then we'll talk a little bit about moving into Tier 4 and what that means for all of us. So as you can see here, so this is our public dashboard, so anybody can access this. Overall within Warwickshire, you can see we've had the peak in November, and then a second peak of our second wave really now throughout December. I think Jonathan and I, we were just sharing, it's not been as bad as has been seen in other areas, but nonetheless, we did continue to see a rise in cases whilst in Tier 3. It looks like more recently there's been a bit of a plateauing perhaps of cases locally, but in terms of that controlling the spread of infection, I do think it's a positive, albeit difficult thing to be going into Tier 4. So this top chart is the number of cases per day across Warwickshire, across all age groups. And then the blue chart at the bottom here is the over 60s. So you can see similarly, we've had a second peak within the second wave for over 60s there as well. Just very briefly to show you district and borough rates. So you can see Rugby, we had quite a significant increase in kind of mid-December. Thankfully, that started to come down now. And it does, as I say, look like other districts are starting to come down, potentially with the exception of Nuneaton and Bedworth, which still seems to be increasing there. I think, yeah, a difficult time.
I think there was some quite interesting local variations, wasn't there, Emily, over that period? So we know within Nuneaton and Bedworth, it's a bit of a rise in North Warwickshire as well in terms of mid-late December, and you mentioned Rugby. We also had quite a big increase in employment within the distribution and logistics businesses, which are very much focused in that part of our county. And we definitely saw a number of cases, didn't we, that you and I were on terms of meeting with businesses in terms of the impact of that agency increases. Sometimes it was 3- or 4-fold the numbers, and I think that has definitely had a big role to play with some of the rates that we were seeing going up in some of those northern district and borough areas in our county.
Yeah, absolutely. And I suppose from other settings, we've seen more outbreaks within care homes quite recently as well. So obviously jumping on those and providing support really quickly to help them get those cases under control. And schools as well. Obviously, we've been on in the holiday period now, but we did see increases in cases. Rugby, some of that peak was linked to a couple of big schools where we did whole school testing to really capture cases quite early and help get on top of that. So we'll see what happens as we move into the new year in terms of schools as well. Obviously, lots of changes announced yesterday in terms of how schools will be staggering their return to school, but we weren't going to dwell on that particularly today, but more wanted to just highlight some of the changes really around going into tier 4 and what that means for people. So there's some nice posters that are available online which give you a summary of what each of the tiers mean in terms of what we can and can't do. So tier 4 really is about that stay at home message. Stay at home as much as you can and reduce your contacts. You can still form support bubbles and childcare bubbles, and you can still meet one person from another household in an outdoor space. So some opportunity to still provide support to people who may be struggling, particularly if they're living alone. But obviously non-essential businesses are closed, and if you can, you very much need to be working from home now. Anything you wanted to add, Jonathan?
No, I think a lot of the things that are on this poster people are already very well aware of. I mean, the most important message I would give, we continue to give over this period, is whatever the decisions you're making in terms of whether you're going for work or going to go out for that walk or whatever else, do them through the lens of keeping yourself, your family, and those around you as safe as possible. And I would certainly be putting some challenges in right now. We have still found business locations where actually some of the activity could be done at home. And I think it's absolutely in our rights now to make those challenges as best we can to say, why, the job I'm doing, could I do it at home? Could I do it in a different way, which actually then minimises my risk, but also the risk of spreading to other people. I think for me, that's an absolutely critical message. We shouldn't be coming across businesses in December where actually there are people who could be working at home that are still going into an office setting. And I think we are in our rights now to make that challenge. Us within our county council made that decision very early on. But a lot of people, vast majority of our workforce have been very capably able to work from home. So if you're working in a customer service centre or call centre, why couldn't that be done in a different way from home rather than having to come in? That would be my challenge.
And I think there's something about empowering employees as well to present that challenge to your employers if you think you could work effectively from home during this period. And similarly, as we're talking to VCS organisations, again, thinking about how you can provide support remotely or by phone for people rather than having people come into work, which I know you've all been very good at doing anyway. So, yeah. Challenging. It has been a bit of a mixed week, I suppose, in terms of having that tier 4 news come in, but also having the good news about the Oxford vaccine. So one that's much easier for GPs to push out and roll out in the community more quickly. And they will be giving the 2 doses of the vaccine for each of the vaccines in a longer interval. So the second dose can be given up to 12 weeks apart and still have the same level of effectiveness. So that means we can get more people the first dose more quickly and have a really good level of protection from that initial dose as well. So I think that's something to hold on to at this difficult time.
Yeah, and I think the other thing is just to reiterate the value and importance that our voluntary and community sectors out there, those of you who are listening to this or sharing this with colleagues, your role in contacting, speaking to people who in your neighbourhood and area who are more vulnerable, who are feeling a bit more isolated, even if that's a phone call or just a text or that that socially distanced walk, something that you can do, that small degree of interaction can make an absolutely massive difference. And now is really the time to kind of reintroduce, increase that vigour to focus on those people who are struggling. I know there's a lot of people out there right now, particularly in this winter period, that are finding it very isolating. So, anything you can do to help with that, help people get through this period is absolutely vital, and a big thank you in advance. And I'm sure many of you will be thinking of neighbours near you that would really value that phone call or that bit of social interaction that make a massive difference.
Absolutely. Well, it's been really valuable for me to be able to connect with people, albeit over Teams, but you know, in many ways still lucky to be working and to be connecting with so many colleagues. It's a lifeline in itself, really.
Definitely.
Cool.
And how are you celebrating New Year?
Oh, we'll be having a big party in our kitchen with all three of us, my husband and my son. We'll get some music on, get the lights going, and party at home. I've made a big banner actually that says 2020, and I'm going to stick it on the back door tonight, and we will bash through it to say goodbye 2020. Happy to see the back of you. That will be therapeutic in itself, I think.
Yeah, a good shout. I think I might make a similar banner actually.
Yeah, I'm really looking forward to it.
Yeah, definitely. Yes, very much looking forward to a new year, and as you say, different challenges, but some proper light at the end of the tunnel. 2021, I think, is going to feel very different once we get into the spring. Yeah,
would really encourage people to hold on to that there is a light at the end of the tunnel. Things will be very different by summer. We will be able to meet people again. So I did just want to flag up the community testing that we've got available within Warwickshire now. So people may or may not be aware that if you are not showing symptoms, you can still access testing, so rapid testing, where you should get your results within an hour. And we've got 4 sites available now. I will just share my screen again to show the details of that. And then we've got 2 more sites coming on in the next couple of weeks. So at the moment, we've got sites live in Nuneaton, Bedworth, Water-Orton and Leamington, and a link at the bottom of the screen here. You can find more information about that and links to booking slots for those sites. Demand has been high, so you may struggle to get a slot, but do keep trying. We are primarily trying to reach people at higher risk, so particularly those who are over 60s, from Black and minority ethnic groups, or people working in higher risk settings, and we're continually evolving our approach in terms of how we better reach those groups. If you've got symptoms, obviously you need to go through the normal route, which is by calling 119 or visiting nhs.uk/coronavirus to book a PCR test. But if you haven't got symptoms, as I say, you can access these rapid tests. And you can access those weekly if need be. We've also then got a site in Rugby that will be coming online next week, and then the following week we'll have a site in Stratford. So really positive to have that as an extra what's the word? Extra ammunition against the virus, I suppose. But key messages are still very much hands, face, space. Really keep your distance. We don't know how much of the new variant we've got in Warwickshire, but we do think it's around. We've had a few workplace outbreaks and care settings where we've seen the virus actually really rip through individuals quite quickly, which is concerning. So even more important to really minimise those contacts, and do things like improving ventilation if you are in a workplace. But yeah, otherwise we hold on to that light of a better life coming soon.
Definitely.
All right, well, thank you all. We will speak again in another week or two. Try and keep these little videos going for you all, but for the time being, wish you a happy new year.
Yeah, happy new year to everybody, and again, big thank you for all of your efforts and support. Every one of those interactions make a massive difference. So yeah, thank you on all of our behalves for the work that you're doing. And as we both said, here's to 2021.
Absolutely. Stay well.
Take care. Cheers. Bye.